How to get over your fear of using ROGAINE and minoxidil. That's what we're going to tackle in this video, so all you got to do is stay tuned. Hey everyone, my name is Helen. Welcome to the Shrimpy McGee channel. Maybe you know me from some of the other ROGAINE and minoxidil videos I've made, or maybe you're just finding me new here right now. In either case, you are very welcome. Today, what I thought I would talk about is how to get over your fear of using ROGAINE and minoxidil, because this is a question I keep getting, mostly over on Instagram. And this is just a recurring thing that I thought I would tackle. I've even made some slides and a sort of mini course. So first off, before we get deep into it, I just want to say this video is for people that have been given the okay to use ROGAINE and or minoxidil. And that is actually the majority of people that send questions to me. Their dermatologist has actually told them to go for it, but you know, they just have fear holding them back. So I'm going to talk about my own experience. I'm going to present some facts about this stuff, because I know sometimes you just, dermatologists and doctors just tell you to use it, but they may not sort of have the time to get into like the whole history of minoxidil and ROGAINE, which I'm not going to do at any great length, but I'm just going to pop out some facts that might help you there. And again, I am not a physician, I'm not a doctor, I'm not a healthcare practitioner. This is sort of about my own experience and just the sort of psychological reframing techniques that I use and I've shared with other people that sort of help to get over that hump, right? To get over those things that seem really scary. I'm not gonna get into all of them right now. We'll do it as we go through this sort of mini course, but like shedding of your hair. People are really nervous about that, being stuck in it for your entire life, that kind of stuff. So let's get right into that. So the thing to know about minoxidil and ROGAINE specifically is that it has been around for a long time, and it is something that you buy, at least here in North America, completely over the counter. This is something you just stroll on up and, sometimes it's actually behind the pharmacist's sort of desk area because it's an expensive product, and sometimes it's just right on the shelves, at least the places I've seen it, both here in Canada and in the US. But the thing to know is that it was actually approved by the FDA, which is the Federal Drug Administration in the US, in 1988. So as I'm taping this is well over 30 years ago now. So it's been on the market, approved for hair loss for more than 30 years. So that was for the men, and for the women, it was approved in 1991. So that's a long time. And if you think about it, there are probably other, pharmaceuticals that you use that are not nearly as old as that. So it has a really long record of being available to consumers, that's over 30 years now. So I personally think that's a really long track record, and that gives me some confidence. I don't know if it's gonna give you any either, but I just thought I would throw that out there because you might not know that. I'm gonna start you off with my best tip, and the one that I often give people when they ask me, again, repeating, for those of you who did not hear or maybe fast forwarded, this is not meant to take the place of any kind of medical advice. This is for people who are okay to use ROGAINE for whatever reason. I can't take you through whether that's okay or not for you. That's something you have to discuss with your own healthcare practitioner, your pharmacist, whoever that might be. But for those of you who are okay to use it, my first tip is to tell people, well, okay, I know that you're nervous now, but maybe one way to reframe the way you think about it is, how are you going to feel in a year from now? Are you going to wish that if you don't try it now and you don't use maybe any of the other things perhaps you've been suggested to use by your dermatologist, are you going to feel regretful that you lost that year and you didn't try it? Or would you rather be a year from now and say, well, I tried it and great, it worked, or even be like, oh, it didn't work at all, it sucked, it wasn't for me, and I'm just glad that I tried it and it's out of the way now. Like, there isn't a right or wrong answer to that. It's just a way of reframing how you think about it, right? In a year, are you the type of person who's gonna be like regretful? I should have started earlier. I should have done this earlier. I've lost more hair since. Or would you rather be at that position and at least have looked back and thought, okay, it didn't work for me. Great. I'm never going to think about it again, or whatever the case may be. Now I need to see what other kind of options I have, or maybe I'm going to live with the situation. Again, no right or wrong answer, but the first place maybe you could start is just reframing how you think about it, not from right now, not from 3 months, but fast forward a year from now and think about how you're gonna feel then. The other thing I point out to people is that, again, this has a really long safety record. It is an over-the-counter type of medication that sits along there with the Advil of the world, right? This is something that you, as I said, you don't need a prescription for, and it is safe. That is why it is there. And it is among the different things that you can do to regrow your hair that involve treatment, really, is very non-invasive. It's not PRP where you're getting a needle, and I'm not saying that that's good or bad, but I'm just saying it is just very easy to do. It is literally a foam or a liquid you put on your head. There is nothing invasive about it, right? So there is that. So I would just like to say at this point, I am also testing something else out that is not Rogaine related for those of you looking for, I guess, a more natural type thing. I am trying out Viviscal supplements here. So I'm actually, by the time you see this video, I might be nearly done. So you want to subscribe and maybe give this video a like as well. And those will help to nudge you when my video does actually come out. So I've been trying out the supplements now for almost 3 months. I'm almost done. I have a video about my midway review. I will link that up, but you'll want to stay tuned to see if, I'm not going to show you my temples now, but I'm going to show you a reveal shortly to see how the Viviscal is working out, because the Viviscal supplements, of all the supplements I hear about from people, is the one that people seem to like the most. I don't know if that's true, because this is the only one I've ever tried so far, but when people compare it against like Nutrafol and stuff like that, people seem to like the Viviscal. So I have been testing it. Stay tuned for that. And without any further, let's get into the slides. Let's get into the actual mini course that I made for you guys. Yeah, let's hop right in. How to get over your fear of Rogaine and minoxidil. So here we go. So why people are afraid of Rogaine, at least from what I hear and from what I see online in other YouTube videos, they're afraid of the side effects, right? Obviously, namely hair loss, which is also called the dread shed or dreaded shed, or some other terms that you'll hear, and we will walk through this, and also excess facial hair. So excess facial hair, I'm just gonna talk about quickly right now. This is the one I get the most from women, obviously, because guys don't care if they get extra facial hair, generally speaking. Women do, obviously, and I just say, listen, all I can talk about is my own experience here. I didn't really get a lot of excess facial hair. I do know women who have complained about it, but for me, excess facial hair is really not a concern. I would 100% just get like one of those little razors that women use and do like the whole dermaplaning thing. And sometimes I have actually tried that out, and it actually does get rid of any peach fuzz that you have. It's just not something that I do. Like, I don't shave my face regularly, is what I'm trying to do. But if I did, I would 100% take a bit of extra facial hair, or even a lot of extra facial hair, in return for closing up the bald spot that I had. You know, I had a significant bald spot in Rogaine/minoxidil over the course of 2 years. I had to be patient. Really took care of that for me. That is not a concern. I don't have any sort of self-confidence issues when I'm going out and the back of my head is showing. It's done a great job for me. So I would take the excess facial hair as a trade-off. I'm not saying that's right for you. I'm just saying that's where I am with that. And excess facial hair is very easy to get rid of. Certainly easier to get rid of excess hair than it is to grow new hair. So there's that. Okay, so let's carry on. We're gonna tackle now the hair loss and the dreaded shed of it all, and the lifelong user fear, right? So people are afraid of being a lifelong user. They're afraid they will never be able to stop once they start using minoxidil, which is the generic form of Rogaine. They don't want to be hooked on a medication or hooked to a medication for their whole lives, and they just want a natural cure. And those are all completely understandable things. I'm not here to say that that's a wrong way of thinking about things. I totally get it, but again, I'm just gonna help you reframe this a little bit. You know, we've got these nervous Nellies out here. Maybe that's you, that was definitely me a little bit. Other things that people could be scared of is like an adverse reaction, itchiness, flaking. Some people are scared of splashing some and growing excess hair or burning their skin with it. So I get that. There are sort of more sort of micro level fears that people have about it, just like making them itchy and stuff like that. And you know, there are treatments for that, right? We'll talk about that a bit too. Again, I'm not a doctor. I can't tell you what to do exactly if these things happen, but I can tell you how to prepare for it, if that helps. So let's continue on. Okay, so what I think you should do if these are fears that you have is just figure out what your specific fears are, because people just like, oh, I'm nervous, but they don't exactly know why. Pinpoint that, write it down. Don't be vague. Take some time to think about exactly what it is about the fear of Rogaine and minoxidil that is bothering you, and hang on to this list. Maybe you want to take it to your pharmacist, look at it yourself later, maybe even after this, show it to a doctor or a dermatologist, because you know, often your time is quick with them and limited. If you have those specific fears, definitely write them down and hang on to them. So shedding, let's talk about shedding. This is like the number one thing that I think women in particular, and guys too, tend to be worried about. They're afraid that they're gonna start using Rogaine and all their hair is gonna fall out. I totally get it. What to know about shedding? Okay. Yes, this is definitely a legitimate side effect of Rogaine, Regaine, and minoxidil. These are all the same things. Again, minoxidil is the generic of Rogaine and Regaine. It occurs in some, not all people, and is temporary. And I got this straight facts from the Rogaine website itself. And theoretically, actually, it's a good thing. And here's what Rogaine has to say about it. So this is a snippet that I took. Here it says shedding, and this is a snippet that I took directly from Rogaine's site. And it just says that Rogaine products stimulate hair follicles to shift from the resting phase to the growth phase. It's not uncommon to see a temporary increase in shedding during the first 2 weeks using Rogaine products. And I will just stop here to say from my own experience, I've heard people having had shedding for longer than that. So if it has been longer than that, then I would say not to panic, definitely not. This occurs in some people as the new hair pushes out the older hairs. When the hair follicle shifts into the growth phase, it's very much like losing baby teeth to make room for adult teeth. This increase in shedding is only temporary and should subside within a couple of weeks with continued treatment. Please note, however, if increased shedding continues for longer than 2 weeks, you should consult your doctor to rule out other possible medical problems. So of course, if you see excess shedding, give your doctor a call. That's maybe just a call to the doctor's office. I don't even know if you need, I know I'm taping this in pandemic times. I don't even need to know if you need to go in for that. My sense would be that probably they'll tell you it's okay to have continued shedding. We'll look at some other things that doctors say. I've got some excerpts here, so you'll want to keep watching this little mini course, and let's continue on. Shedding is clearly a risk. They say it on Rogaine's website. They're not hiding that information, and maybe that's the thing you're the most nervous about, but let's continue on here. Let's see what other facts I've dug up. Okay, according again to the Rogaine website, I took this little snapshot from their website. It says 80% there. For women, more than 80% of women using women's Rogaine foam once daily increased their hair count in a 6-month placebo-controlled clinical study. So that means, half of the women, I would imagine, had the placebo, so they didn't have any active ingredient, and half of the women had actual Rogaine, and of the ones who were using actual real Rogaine, 80% of them increased their hair count. So I guess they were in there counting the hairs, and they had more hair after 6 months. Again, I don't care if you use Rogaine or minoxidil or not. They are not paying me a cent, okay? In fact, I tell people to use men's Rogaine because it's cheaper than women's. It's the exact literal same thing. And I'm pretty sure that has precluded me from ever collecting a penny in sponsorship money from Rogaine. And I'm totally fine with that. I don't care. I'm just here to speak my truth and hopefully help people if it does help. So yeah, that's a pretty good statistic, 80%. I don't know that's not actually very, they don't splash that across their stuff, but I did find that on their website. But it's not like a stat that you see on the box or anything like that, but I thought it was interesting to know. So let's talk about lifelong use. And this tends to be a concern from what I hear from women among the younger set. Like the 18 to sort of 25-year-olds is what I hear. And they just don't want to be stuck on anything for their whole life. Can you blame anybody who thinks like that? Of course not. My thinking though about this is, new treatments are coming. If you're 20, you'll be 30 and 10 years from now. You don't know that they won't have discovered something by then that works really well. Like right now, PRP, which is like a plasma injection that they're doing, this is new technology, but we don't know how good it's going to be in 10 years. It might be fantastic and super effective, and that would just be using, basically your own blood is what PRP is, and you might not need Rogaine at all. Like, we don't know what the future holds, and so I think it's reasonable to have hope that you won't be stuck on this your whole life and they'll have figured something else. I mean, you think in the year 2021 they would have figured out the whole hair loss thing? They haven't. I am shocked about it just as much as you are, but until then, we do have treatments such as this that are effective. So lifelong use, let's keep going. Okay, is it true that you have to keep using Rogaine or minoxidil your whole life? Yes, it is true. You have to keep on using minoxidil forever to keep up with the gains that you have if you end up having them. But I just want to say here, again, another way to reframe this is most of the self-care things we do in life are lifelong. Self-care is not usually just a one and done kind of thing. Toothpaste, shampoo, deodorant, these are all topical things that we put on our skin that we commit to for life. And, do you really have a qualm about using any of those things? And I'm not saying that this is right or wrong. I'm just saying, this is maybe another way to think about it. Another technique you can use is not like, oh, it's so bad, it's so sad, it's so tragic that I have to use this forever. But on the other hand, try and think about it this way. You are lucky, really, if you're watching this and you can afford Rogaine or minoxidil, that you have access to an over-the-counter medication that's safe, effective, or else dermatologists wouldn't recommend it, and pretty affordable. I mean, the Rogaine brand itself is kind of pricey, but the generic is quite affordable for what it is. You've seen me make videos here about how I've got it from Target. Like the generic stuff, it was like $20 and there were 3 bottles in there, which is an incredibly affordable price. That lasted me about half of a year, that particular supply. So many people use daily medications and there's really no shame in it. It's not a dependency, it's a strength to be able to know what you need to make the decision to use something that has been approved to you by your doctor. It is not a sign of weakness, and I think a lot of people feel that it is some sort of personal failing. It absolutely is not. You know, if anything, you're just cleverer than most people because you've sorted it out. Why go on being miserable when there's literally something that might be able to help you that you can afford and is easy to obtain? So let's move on to now, what do doctors say? I got this from, I think, the Real Self website. I can't remember the website name off the top of my head, and I'm not 100% sure I wrote it here. Okay, so the thing to remember, I'm not a physician or pharmacist. Again, check in with your own healthcare provider, doctor, nurse, dermatologist, whoever it is. But this is what some actual dermatologists have to say about hair shedding and the fear of Rogaine or minoxidil. And I'm so sorry to keep hammering down the whole I'm not a doctor thing, but you would be surprised at the questions I get. I mean, if you don't believe me, look at some of my older Rogaine videos and see the type of questions people ask me. They're much more suited to a doctor than me. I am a YouTuber, okay? If I were an actual dermatologist, I would not be doing this right now. I'd be busy with my patients. Okay, so, okay, here we go. It's Real Self. Okay, it's realself.com. Info from realself.com. Sorry about that. I'm scared to use Rogaine because people say it makes your hair fall out. So that was a question here on this website. And so let's see what a hair restoration surgeon, Dr. William Rassman, says about it. He says, Rogaine or minoxidil sometimes produces a shed for up to 3 months. Right, so this is what a doctor who specializes in hair restoration surgery says. But the shed will stop and then you'll get the benefit of the drug. Most people do not experience this shed. So don't take it from me, take it from Dr. Rassman. Okay, Dr. Surowitz here, Josh Surowitz, who's a board certified facial plastic surgeon, says to the question, will Rogaine cause your hair to fall out? This is what he says. Thank you for your question. This is a very common concern among patients. So that's you. Hair goes through a defined cycle of growth, anagen, rest, catagen, and shedding, telogen. Any treatment option that promotes growth, like Rogaine, Propecia, and laser therapies, will cause the hair in rest and shedding phase to be accelerated through those phases so that the follicle is in the growth phase. Androgenetic alopecia results in premature disruption termination of the growth phase. That's an accumulative process such that the end result over time is serial miniaturization, thinning of hair, and ultimately hair loss, right? The goal of non-surgical treatment options is to maintain growth phase for a longer time and to lessen, in some people, miniaturization. In short, the shedding you're concerned about is a normal physiologic process which is necessary to allow hair growth. Best of luck. All right, here we go. Dr. Jeff Donovan, certified dermatologist. I know this doctor, not personally. He's a Canadian dermatologist, really well known in the hair loss sphere. I often refer to his website. It's really good for really just trustworthy information on like Rogaine and different treatments, be them natural shampoo information, that kind of stuff. He has a really good website. But he's not treated me personally, but he did chime in here. Rogaine and hair loss, I'm scared. He says, I understand your worries, but keep in mind that everything that helps genetic hair loss, so that's like your male pattern baldness and your androgenetic alopecia, causes hair loss, including Rogaine, laser, hormone blocking medications. Anything and everything that works has a risk of shedding. Things that don't work don't cause shedding. I often advise patients that doing nothing also leads to hair falling out. So, so there you have it. So if you don't do anything, you know, and you're on a path of hair loss, unfortunately, your hair will continue to fall out. So the main takeaways from what I've read and these snippets from doctors, and I did double check, by the way, I did double check that these are actual doctors and not just like people trolling. For every doctor that you saw there, I double checked that they are actual active practicing physicians and not just like catfishing us. The main takeaways, products that work can also cause your hair to fall out. So we heard that from Dr. Donovan. Products that don't work, according to the dermatologist, Dr. Donovan, who's also not only a medical doctor, but also has a PhD, do not cause your hair to fall out. And most people do not get hair shedding. So that's the majority of people will not get hair shedding. So your assignment from me, okay, is to ask yourself, why are you drawn to Rogaine or minoxidil? What is appealing about it? So maybe you want to sort that out. Right? That could help you sort of, again, just think about what your priorities are and what you're hoping to gain and what you're afraid of. What do you think will happen if it doesn't work? And is this a realistic fear? Again, those of you who've done like CBT type therapy know that this is a common thing, and I'm not a therapist, of course, but I've been on the receiving end of some of these kind of questions, just to think about like what is the worst case scenario and how likely that is to happen. And then lastly, and maybe most importantly, what is your plan if you start to use it and something goes wrong? If you have itchiness or excessive shedding or excess hair growth, who can you contact? Not me. I mean, like doctor-wise, can you contact your doctor? Do you have something like a telehealth appointment you can do? Do you have like a dermatologist that you got this advice from that you need to circle back with? So, have a backup plan if you do start getting some side effects that worry you. Maybe that will help to alleviate what you're going through. And if you do start to have them, definitely write them down so that when the time comes in, you do have that appointment or that opportunity to ask your healthcare practitioner, you'll have them all in front of you in written format. Okay, everybody, I'm going to wrap it up there. Hope that was really helpful for you. Be sure to check out all the other content I have about Rogaine, minoxidil, my experience with it. I do a lot of shampoo reviews as well because, as we know, a lot of people think that shampoo can cure hair loss. It cannot, but if you're curious to see me review a lot of these products, you know where to find me. I'm going to leave you all off there. Hope you're doing well, and thanks so much for spending your time here with me.